Good afternoon. As Grace kindly said, I'm Ward Oakley, orthopedic surgeon from Pinehurst, North Carolina, the hinterlands of North Carolina, so to speak. After hearing the speaker, I'm quite sure why I'm here. So I'm looking for a little support. Are any surgeons in the group? Any surgical specialists? A few hands, thank you. So I'll press on. Pinehurst Surgical Clinic is a group of 38 surgeons. We have 17 mid-level providers and complementary ancillary services and satellite clinics and those kind of things that are important to our practice. Pinehurst Surgical Clinic's been in existence since 1947, so we've been around a while. In 2005, we instituted electronic medical records. That was a big step, a big challenge. We're in that full blown. It's pretty complete. All the services I've mentioned are integrated in that record. And luckily, the other big medical group in town also has the same system, so we're able to exchange data. And we're right now actively involved in the hospital trying to make that transition to data pretty simple. But after 2005, 2006, we moved into this new facility, which is right across the street from the hospital. So we have a close relationship with the hospital. Obviously, most surgeons do. So now I have to wonder, what value am I going to be able to bring to you in this subject of value-driven initiatives from physicians? So let's press on, see what I can add, or see what you can ask me later on. The usual things we've done in our clinic are the ones most people I think are doing. Those are patient satisfaction issues, as well as the satisfaction from our sources, employees of the hospital. We even surveyed that. That's interesting data that you can that comes back to your surgeons. I always push for unblinded data, so everybody knows each other's data. This is important. Our data for our patient is we use a Press Ganey system for collecting patient satisfaction data. Collects all types of information, so we know which provider, what locations at, what time of day, that kind of stuff. We also have and that presents us with this kind of data, which I know is confusing, but that's intentional. It lists all the physicians on the left side and all the data categories across the top, from patient satisfaction to wait time, satisfaction with the nurses that they encounter with, satisfaction with the front office, and also the ancillary services. And the red boxes are not meeting up to our goals. Green boxes meet satisfaction, and that's all tied in together with some other factors we measure. What I think is very important physicians will see is that there's space for the patients to write comments, and that's fed back to each department, unblinded, about which doctors got what comments from their patients. It does drive results and collegiality. We do a KPI for organizational measures, the 5 pillars of excellence: service, people, quality, growth, all those things that we measure. But what we use this for, not only for our physicians, but also for our employees. Their bonus is based on our KPIs. For example, this quarter, their employees get a maximum bonus of $420, but a percentage of that is based on their individual and their department KPIs, how well they do for their department success. We have meaningful use measurements. We all have those with our electronic medical records. They're pretty easy to maintain. Nobody likes measuring these kind of things. As surgeons, we don't like doing that. But once we saw the financial gain from it, it does change behavior. And it does set the groundwork for future role in integrated systems. Things we're working on now are the time-dependent, activity-based costing issues, what it costs us to process a patient through the system, also clinical outcomes beyond just what we see in the office, long-term outcomes. Our vision is surgeons of choice. That's going to be our challenge. How do we become surgeons of choice in the upcoming ACOs that has been presented to you this afternoon? That's our challenge. We work very close with the hospital. We have initiatives there. We're approved for bundling for total knee, total joints, bundling for cabbages. We're working with them on the other issues that are important to the hospital, readmissions, patient satisfaction. In fact, our data for patient satisfaction stimulated them to do their own at that same level, again, unblinded data, so physicians see each other's results. Because most physicians say when they see data that's not looking good, it's always the other doctor, it's not me. But when you got your name on it, it means something. So we have stimulated the hospital to kind of increase their role in that regard. Now, we also have a committee it's initiated by the physicians that are employed by the hospital and the physicians of the community, to drive quality and outcomes issues both within the hospital but also within the community physicians. We try to use the American Board of Internal Medicine's Choosing Wisely initiatives with rather simple guidelines that are very interesting to read, that are worth evaluating and measuring in the future. Now, where does that bring us as surgeons? Where do we see the value in working together, the integration? Right now, the money for us is only in the meaningful use measurements, which is going to, it's going to run out in a year or two. Electronic medical records, those benefits there. The hospital have their benefits. Working together with the hospitals, we see bundled payments, gain sharing issues, and co-management services are available. We're just really kind of getting started on that. What we're really talking about today is the future. How do we as surgeons interact with other primary providers and with the hospitals? What's the right path for us? But we see the importance of the community. If it's not working for the benefit of the community, then you're there for the right reasons. You got to keep patient-centered, and you got to think about your community. Because we, as surgeons, we can't live without our hospital and it being successful. We don't want it to be a lost cause, but we also understand the importance of taking care of our community and our patients. So I hope that is any value. It has been for me. Thank you. I'll turn it over to Grace.